Well, now to a problem that a surprising number of men live with. And in the past, if you had a so-called flabby chest, you would just cover up and hope that no one notices.
Now, though, more and more men are attacking the problem head-on and seeking professional help to regain a more masculine look.
With more, here's our Mina Ree.
I'll have a quick look if you don't mind.
We've disguised their faces because the condition these men have had to endure has left them emotionally scarred.
And they kept getting bigger. Like I said, in the last 5 years, they've grown even more.
I didn't have a word for it, but all my classmates did. The guy with the big breasts.
Causing them to hide under bulky layers of clothing all their lives.
You want me to wear a bra?
And the source of comedy on shows like Seinfeld.
The man's ear.
Amidst a sea of derogatory names, the proper term is called gynecomastia. Literal translation, female breast.
Medically, I think of it as being breast tissue. These are the mammary glands. These in women are what enlarge and produce breast milk.
They're sensitive. If I press my chest up against a wall, it hurts.
According to surgeons, up to 40% of men are afflicted with the condition. Dr. Bray operates using a new technique called body tight, which, unlike traditional liposuction, is able to melt and suck up the rubbery, dense breast tissue along with the surrounding fat pockets. But that's not all.
That heating also encourages the skin to tighten. It's like shrink wrapping.
This 43-year-old describes the procedure as life-altering.
One of the first to take my tops off on a warm day, which is very liberating after all those years of suffering.
Most patients develop gynecomastia during adolescence when the hormones are in fluctuation. Now, if gone unchecked, it can become exacerbated after the age of 25 when testosterone levels normally begin to fall.
While exercise alone won't produce the same dramatic changes as surgery, it can make a difference if done in combination with a proper diet.
So you want to make sure that you're reducing your exposure to estrogen or estrogen mimickers,
which means cutting out things like soy and staying away from hormone disruptors. Focus your workout on strength building, high weights, low reps to the point of exhaustion.
You're trying to get more lean muscle so you have more testosterone so that you're not creating as much estrogen.
Absolutely the greatest thing I've ever done for myself.
Men are choosing not to suffer in silence anymore. Mina Ree, Global News.
Still ahead on the news.